welcome once again to Voice of the Coast. We are joined now by the Chief Operating Officer for formerly Teche Action Clinic, now Teche Health, Athan Olivier III, and we appreciate you coming in to talk with us today.
Thank you for having me.
You've been with Teche for a couple of years, but a well-traveled young man from what I understand.
Yes. I've been with Teche 2 years now, and it's been a whirlwind. I'm grateful to be a part of the organization, but I'm not new to the parish, St. Mary Parish.
Mm-hmm. From St. Martinville originally?
Originally from St. Martinville, yes, born and raised.
Your family moved around a little bit before you came back here.
I have. Actually, after graduating high school, I moved to Baton Rouge. I graduated from Southern University, and then I moved out to Illinois. My wife and I lived there for a while. Moved back to New Orleans, where I got my master's in healthcare administration there, and moved back to the Acadiana area.
Mm-hmm. How did your path cross with Dr. Gary Wiltz?
Well, back in 2008, when I moved back to the Acadiana area, I reached out to Doc, and he's always been a mentor of mine. He's always been a resource, an advocate for patient care. So he's always been a champion in my corner. So when the opportunity presented itself for me to work alongside of my mentor, it was an opportunity that I could not pass by. So I've been with Doc for a long time, about 20 years now, collectively.
Yeah, and always expanding company, always evolving business. Teche Action Clinic for a long time. Why the new branding to Teche Health? Well,
the new branding actually occurred, we celebrated our 50th anniversary last October. And with that 50th, we decided, let's rebrand. The community knows us as Teche Action Clinic. But, going forward, Teche Health was a catchy name, and it just coincided with a rebrand, just a rejuvenation of what we're trying to do. So Teche Health.
Okay. And obviously involved with that, you want to kind of present some new, not necessarily new services, but refocus some of the concentration on what it is you're doing. What are the biggest changes people will notice as this rebranding evolves?
Yeah. Well, something initially, we're taking down all our old Teche Action Clinic signage, and we're rebranding and repositioning with Teche Health. So that's happening, immediately. And the goal is for Community Health Week on next month, we're going to unveil our new logos in our buildings. That's the plan. We also have exciting opportunities right now. We're expanding and growing in our Gramercy market. We're building a new 10,000 square foot facility in our Gramercy market. So we're excited about that as well. That's going to be unveiled hopefully this year as well.
And I'll admit, I was a little surprised to see that. I've always kind of thought of, especially because of the central location in Franklin, that the focus I always kind of thought was more towards into Iberia and Lafayette, but you're getting more and more of a presence into the Bayou region and even towards New Orleans.
Absolutely. The patients within our health system, we've reached 20,000 patients in our system. And those patients are not solely in St. Mary Parish. We provide services throughout 6 parishes in Louisiana. But to your point, our focus is 90 East. And we're infiltrating into the New Orleans market as well. So wherever the service is needed, Teche will try to meet the needs of the patients.
Within KWBJ's viewing area, you have 3 clinics here in Morgan City, the main clinic in Franklin, of course, and in Pierre Park. What are some of the main services that your customers can expect in those clinics?
Well, something new and exciting, in addition to our routine services, our primary care medicine, our behavioral health services, we have pharmacy services, WIC services as well. We're offering expanded hours on Saturdays. So we have Saturday clinics right now, giving our patients access to appointments on the weekends.
And that's fairly new, right? Here in it's available in Morgan City and Franklin, not in Pierre Part, unfortunately. But,
not yet.
And in Houma, yeah.
And in Houma.
Are the services the same as what you can get during the week?
Yeah, you get your basic services. We're there to treat whatever illnesses the patient present with. We provide primary care medicine. We also do behavioral health appointments as well through telehealth services. But wherever the need is, we're going to meet the needs of the patients. So if it's justifiable that we need more service lines on the weekends, for sure we're going to try to meet the needs of the patients.
Very good. All right. Tell you what, we're going to take a quick break. Stay with us. We'll be right back with more Voice of the Coast. Welcome back to Voice of the Coast. Our guest today, Athan Olivier III, Chief Operating Officer for Teche Health, formerly Teche Action Clinic. And we were speaking before the break a couple of topics that you hit that I wanted to come back and emphasize. In-house pharmacies, you got a couple of those in your clinics, and that is just such a game changer, such a huge advantage for your clients.
Absolutely, it's a value add. You know, it's a convenience. So our patients literally, they could see their provider in their exam room, literally walk down the hall, check in with the pharmacy department, and get their prescription fills. You know, in addition to that, we also have mobile pharmacy, meaning that we can deliver scripts to the patients at the home.
Excellent. All right. And we talked about telehealth a little bit. And obviously, COVID really changed the complexion of personal health care, and telehealth has really become a big part of that. But not everybody may know what that means. What is telehealth about?
Yeah, well, telehealth, it gives our patients the option to have a touch point with their provider. Those patients that may have transportation issues or difficulties physically making it to the clinics, we could meet the patients where they are. So it gives us a touch point with the patients in their surroundings without having them physically coming to the appointment.
Yeah. And obviously, I don't think anything is ever going to replace the physical meeting of doctor and patient, but how much can you really accomplish through a telehealth visit?
Well, you know, we get extremely creative. So we have a platform, remote patient monitoring. So you're a patient of Teche, you're in a home setting. I can have a device that reports to us your blood pressure, your heart rate, you know, your O2 sats, you know, so we can have tabs and monitor on you at the home. Anything that deviates from a norm, it'll alert us, and we could render care as needed. You know, so it gives us an extra set of eyes in the home setting.
What do your patients have to do to be able to access telehealth? You need some kind of special, obviously you must have to have a special phone app.
Well, as long as you have a cell phone, cellular device, you can log in or tap in to our platform at Teche.
All right, and if it gets to the point where face-to-face contact is necessary, I noticed you're getting bigger into your use of your mobile health units. Let's talk about that a little bit.
Yes, sir. Yes, sir. We have 3 mobile units in our fleet, and the mobile units allow us to dispatch to those communities for campaigns or community events. Or if there's a need, if there's a population of patients that physically can't come, well, you know what? We can come to you. And that's a classic example of us meeting the patients where they are. You know, Dr. Wiltz, he loves to frame, we meet patients where they are, and that's a classic example through our telehealth services or our mobile health units. We're meeting patients physically where they are.
And I'm afraid I might have been misleading on that. This is not a situation where you can say to a person that you're dealing with through telehealth and saying, you know what, we really need to be face-to-face. We'll send a mental health, we'll send a mobile health unit out to you. That's not happening.
Yeah, we're not there yet. You know, we're not going to rule it out, but we're not there yet. But this just gives us an extra arm to extend, you know, care to patients that are in need.
Okay.
Yeah.
What's the range as far as where you will send a mobile health unit for a function?
Well, you know, where there's a need, we're going to participate. You know, of course, we're throughout 6 parishes in the state, but, you know, if there's a need or an event that calls for us, you know, we will try our best to participate. Absolutely.
Okay. Once again, your brick and mortar clinics here in this area, in the KWBJ viewing area. You have one in Morgan City, in Franklin, and in Pierre Part, plus locations in Houma, Thibodaux, Dulac, Reserve, Gramercy. You're out there.
We are.
We're just about out of time here, but let's talk a little bit about the finance of healthcare. Obviously, a lot of changes are being proposed in Medicaid and Medicare right now. How is that affecting you?
Well, absolutely. You know, and that's a hot topic, as we all know. And, you know, as healthcare providers, our duty and our obligation is to care for patients. You know, so we have to focus on providing quality patient care, despite whatever budget cuts may come down. We're heavily funded on federal grants. We are. But we also have the ability to generate our own revenue. So one thing that Dr. Wiltz charged us with is, you know, we have to operate with efficiencies all across. So every angle that we can to cut costs without compromising patient care, we're looking at that. But it is challenging times right now for the whole healthcare sector.
So what does this mean to your patients who might be facing cuts to their medical coverage?
Yeah. Well, it means that we're going to meet you where you are. We're going to do our best to provide you with the care that you need, and we're going to try to help facilitate and getting you resources that you need to help fill those gaps.
Okay. Just about out of time. What's the easiest way for your potential clients to reach out and, contact Teche Health?
Yeah. Well, so we're accessible. You can meet us at www.techehealth.org, and it gives you all of our locations, our contact information, and our providers.
All right, very good. Athan Olivier III, thank you for joining us.
Thank you.
We appreciate you being here with us on Voice of the Coast.